Welcome everyone to the Canadian Diabetes Association's 2016 webinar series. My name is Farah Ismail and I'm a program manager for the CDA and I will be your host for today. We are delighted that you are able to join us today for the webinar to learn about how to ignite your motivation and manage your diabetes well. To start off, I'd like to draw your attention to the survey at the top right-hand section of your screen. In order to better serve your needs, we kindly ask you provide us with your input by completing the survey towards the end of the presentation, and we thank you in advance for your input. Now, throughout the presentation, you will have the opportunity to ask questions, and this can be done simply by typing inside the Q&A box, which is located at the bottom right-hand section of your screen. And we'd be happy to answer the questions towards the end of the presentation. We also will be displaying a few polling questions throughout the presentation and would love for your participation. It is important to note that all questions and responses will remain anonymous. Also note you're able to customize your screens, so you can expand them and collapse them as you feel the need, and you can simply do that by dragging down the bottom right-hand corner of each of the webinar pods. Our presentation today will last from 35 to 40 minutes in length, and we'll have about another 10 to 15 minutes at the end for questions. It is important to know that our presentations are recorded and posted on our Canadian Diabetes Association website, as well as our CDA YouTube channel. So now I'd like to welcome our speaker, health coach Alison Toron, and thank her for joining us today. But before turning it over to Alison, I'd like to give you a brief introduction. Alison is a health coach with the Live Well Bien Vivre program, a community-based wellness program in New Brunswick that helps individuals make healthy lifestyle changes to prevent and manage chronic conditions like diabetes. Alison holds a doctoral degree in English from the University of New Brunswick and is also the co-owner and operator of a small business specializing in fresh pasta. For more information on Alison, please read the speaker bio section, and that's located on the left-hand section of your screen. So without further ado, I'd like to present to you Alison.
Thank you so much, Farah, for the introduction. And welcome everybody to the Canadian Diabetes Association's webinar, Ignite Your Motivation, Your Guide to Staying on Track with Diabetes. So as Farah mentioned, my name is Alison Toron, and I am a health coach with the Live Well Bien Vivre program, which is a community-based wellness program in New Brunswick, which is administered through the Canadian Diabetes Association in partnership with the New Brunswick Department of Health and the Medavie Health Foundation. And I do just want to say a few words about Live Well. So in a nutshell, my job as a health coach is to help people make any healthy lifestyle change they want to make by working with them one-on-one to achieve their wellness goals and to help them navigate to appropriate wellness and health resources in their communities. So Live Well Bien Vivre targets 6 areas of New Brunswick to help individuals prevent or manage chronic conditions like diabetes. We work with anyone as long as they're 19 years of age or older, and it's completely free. There's no charge associated with it. And we support their behavior change in the areas of healthy eating, physical activity, tobacco cessation, and/or mental fitness. And before beginning my work as a health coach, I was a university instructor, and as Farah mentioned, my husband and I also own a small business. So that's a little bit about me. Now I'd like to hear a little bit about you. So I'd like to begin with a few polling questions just to get a sense of who is in the audience today. So as you can see on the screen, my first question for you is, what is your geographical region? Are you joining us from the Atlantic provinces, from Quebec, Ontario, the Western provinces, the territories, or outside of Canada? And if you haven't already, you can just click on the screen to submit your response, and I'll just give everybody a second to do that. Okay. So it looks like we've got The majority in Ontario and the Western provinces, but we do have some people at 12.3% in Atlantic Canada, so yay, representing Atlantic Canada. That's where I am, in Fredericton. And a few people from Quebec and from the territories, so it looks like we've got a good geographical spread within Canada and almost 2% of the population outside of Canada, which is really great to see. So thank you all for answering those questions, just to see of who we have in the audience. Our next question is, what is the primary way that you are affected by diabetes? So are you living with type 1 diabetes, type 2? Are you living with prediabetes or gestational diabetes? Are you a healthcare worker? Do you have a family member or friend who's living with diabetes, or are you simply interested in the topic? So if you haven't already, if you could just click your response there, and I'll give everybody again just a second to do that. Okay, so it looks like the majority, 57.4%, are living with type 2 diabetes. So we do have a pretty good contingent, almost 14% living with type 1. A small amount, 2%, living with prediabetes, nobody with gestational. A good percentage, 16.8%, are healthcare workers, which is wonderful. And we've also got people who are simply interested in the topic or have family and friends living with diabetes. So that's great. Thank you very much for answering those questions. So as the title of this webinar suggests, today we're going to be talking about motivation. So basically, motivation can be distilled into two simple words: I want. So you can think of motivation generally as the reason that we do anything. So it's the reasoning that kind of underlies our behavior. And that reasoning can be conscious. We can be very aware of why we're doing things, or it can be unconscious. Sometimes we don't really know what our motivations are, but basically it is the reason we do anything. It's kind of the reasoning that underlies our behavior, as I said. So we're going to talk about motivation and different kinds of motivation and your own personal motivation for wanting to be healthy and manage your diabetes, or simply to adopt healthy behaviors. We're also going to talk about skills. So this is the I can that you see in the outline here. And we're going to specifically talk about skills that we already possess, so the things that we're good at right now. And we're going to talk about skills that we would like to build on and how this can help with our motivation and achieving our health and wellness goals. We'll also touch on knowledge. So this is the I know component that you can see on the outline here. This one is kind of the easiest and the most straightforward of the three to learn, because you can gain knowledge by sitting in a classroom, by listening to a webinar, by doing research, for instance. So it's kind of the most straightforward of those. So generally, we're going to talk about how all of these topics, along with your social support and your environment, can affect the outcome of your motivation. So what behavior actually comes out of your desire to do something? So the I act part of the outline here. So what you actually do. And we're going to frame this specifically in terms of health and wellness goals. And I'll talk a little bit more about that as we move on here. So in a nutshell, this is what we're going to cover today, or tonight if you're in Atlantic Canada like I am. Okay, so now I want you to think about what motivated you specifically to join this webinar. Why did you come here today? So are you here because you struggle getting motivated to be healthy? Maybe your motivation tends to wax and wane, which is a pretty common phenomenon for most of us. Do you want to stay on track with your diabetes self-management, but you find it difficult to do so, either to get motivated or to stay motivated? And in general, what motivates you for your health and wellness? Whether or not you are living with diabetes, what motivates you to adopt healthy behaviors? If you're living with diabetes, what motivates you to achieve good diabetes self-management? So as you ponder these questions, I'd like to draw your attention to the worksheet that we will be referring to during the duration of this webinar. It's called Ignite Your Motivation Action Plan, and you can find it in the resource list section of your screen. So if possible, please bring that up on your screen or print it out. We will be referring to it. If you're not able to access the motivation worksheet right now, that's fine. You can always look at it afterwards. But it might be useful just to jot down a few things as I'm talking so you can come up with your own motivation action plan. Or if that's not feasible at the moment, you can just listen along and sort of consider and think about the questions that I'm going to be asking that have to do with your health and wellness goals and your motivation for achieving them. So what is motivation? So as I mentioned at the outset, motivation can be distilled into those two simple words, I want. It's the desire or the willingness to do something. It's a force that causes us to act. The government of New Brunswick defines motivation in this way, which I find to be quite a helpful definition. Motivation is a dynamic concept originating in the perception someone has of him or herself and his or her environment, prompting him or her to choose an activity, engage in it, and persevere in order to attain a goal. So another way we could think about this is motivation is the theory behind what we do, and what you actually do is the practice, if you want to think of it in those kind of more academic terms. So motivation, the desire or the willingness to do something. And throughout this webinar, I'm going to be asking you to think about your own motivation. So as you do that, I'd like you to turn to your action plan and think about a wellness goal that you have for yourself. So what do you want to achieve for your health and wellness? It could be anything at all, and I don't want to be too specific because it is very personal and it will depend on what you want to do for your own health and wellness. If you're thinking about diabetes specifically and self-management, this could have something to do with eating healthy. It could have something to do with getting more physically active or maybe managing your stress in a healthy way or something else entirely. But any of those things I just mentioned really apply to all of us, no matter if you're living with diabetes or not. But I do want you to think of a wellness goal and to jot it down on your worksheet or type it into your worksheet if possible, because that's kind of going to be our starting point to have us think about our own motivation and how we can get ourselves motivated for our health and wellness. So I'll just give you a moment to think about that and write something down if possible before I move on. Okay, so as you're thinking about your health and wellness goals and how we can get motivated to achieve them, I'm going to talk about motivation, so what it means and the different types of motivation that you may or may not be familiar with. So as you can see from the slides here, we've got three main categories when it comes to motivation. The first is amotivation, so really it's the equivalent of having no motivation at all. So as you can see from the dude kind of chillaxing on the couch there after a long day of work, it is a lack of motivation. It's not feeling motivated. And I think most of us have periods of amotivation, but hopefully we also are motivated by external and internal motivation to be healthy. So we're going to talk about those two categories, the external motivation and the internal motivation, in a little bit more detail. So I'll elaborate on those two in a moment. But I did just want to point out that there are three main levels of motivation. So external motivation tends to be the one that we usually think of when we're thinking about motivation and what motivation is. It tends to be the one we think of the most. So in a nutshell, it comes from outside factors, such as a competition or reward. So it means being motivated by something that is outside of ourselves. So you can see in the examples that these are all kinds of external motivators. My doctor says I'm at risk of developing diabetes and I need to change my diet. So that's an example of a force that's outside of the person, making them move towards changing their behavior. Or if I lose weight, I could win the competition at work. So again, someone's doing something for their health, not because of any intrinsic or internal reasoning, but because they want to win a competition. So external motivation tends to have short-term impact. It's not quite as useful in making long-term sustainable changes, but it does have short-term impact. But it can be really, really useful because it often helps you jumpstart things. And it can be a really useful tool for you to use when you're stuck, when you're feeling particularly unmotivated. Sometimes getting that external push, whether it's from a competition, from some sort of contest, from somebody else kind of telling you to do something, it can be just that little nudge that you need sometimes to make some changes. So as a health coach, sometimes I represent that external motivation for people. So having someone to talk to about your plans to make healthy lifestyle changes is sometimes that little outside push that you need to get you rolling on things that maybe you were planning to do anyway. So it comes from outside of us. On the other hand, we also have internal motivation. So this type of motivation comes from within. So it comes from inside of you. And it's always wrapped up around your own values, your own interests, your own enjoyment. So basically what's really important to you and your sense of self, who you are, who you want to be. So as you're probably gathering, it's much more entrenched with our ideas of identity, so who we are as people and what's really, really important to us. So internal motivation tends to provide a sense of satisfaction, true satisfaction, in both doing a task and completing it. So it's a little bit more meaningful, and it tends to have longer-term impact on our behavior. So in other words, it's much more likely that you're going to be able to change behaviors if you're making those behavior changes because of a true kind of internal motivation. So you're doing it for reasons that are really important to you and your sense of what's important in your life. So as you can see in the examples here, someone might say, playing in the park with my grandchildren gives me joy. So this person may have made some health and wellness changes, and they're motivated to be healthy because obviously their grandchildren are very, very important to them and give them joy. So it has to do with what's really important in this person's life. Or I'm so much more confident now that I'm eating healthy. So again, that kind of sense of internal pride, feeling good about yourself, that kind of thing is much more personal and tends to have longer term impact. Sometimes my clients will say things to me like, I want to be healthy when I retire so that I can actually enjoy that time. I've worked really hard all these years, and it's really important to me that I feel good when I retire so that I can actually get some enjoyment out of those years. So again, thinking about, what's really important to you and what really, really matters. So now that you understand internal and external motivation and the difference between the two, I want to hear from you. I'm going to read a couple of statements here, and I want you to tell me whether you think that they represent internal motivation or external motivation. So the first one, as you can probably see on the screen here, says, I am so glad I finished the Learn to Run program. I found a new hobby. Is that an example of internal motivation or external motivation? And I'll give you all a second to answer that question before I move on to the results. Okay, excellent. So a little bit of disagreement here. So the answer that the majority of people chose is correct, internal motivation. And the reason that this is an example of internal motivation is that it has to do with pride, being glad this person finished this program, and also the finding a new hobby part. So it being something that the person obviously enjoys and gets enough meaning from that they're going to want to continue on with it. But that being said, there is an aspect of external motivation here, and that there is a Learn to Run program that is mentioned. So, you know, the parameters of a Learn to Run program usually have things like alerts that ding on your phone, or, you know, certain distances that you're supposed to reach. So that kind of external motivation is there. That's definitely a component of this question, but for the most part, it's the sense of pride and finding a new hobby that really make it a kind of internal motivation. So put another question up on the screen here. I want to fit into those pants before my vacation. Is this internal motivation or is this external motivation? Give me a second to answer that one. Okay, interesting. Quite a split here. So this is an example of external motivation, actually. Looking at a pair of pants and using them as kind of the push that you might need to sort of think about, you know, maybe losing weight or exercising more or eating healthy is an external motivator. There might be some kind of element of internal motivation here, so feeling like maybe it's important to this person to make these changes, but really focusing mostly on something that's outside of yourself as a motivator to make you make some health and wellness changes. This is an example of external motivation. Interesting to see the split in answers there. Okay, so now I would like you to turn back to your action plan worksheet and start writing down some of your own external or internal motivators, now that you know the difference between the two. So thinking specifically about the wellness goal that you established at the very beginning and hopefully have written at the top of your worksheet, why do you want to do that? Why do you want to achieve that wellness goal? What's your motivation for doing so? And I want you to divide your motivation into two categories. So as you can see here in terms of examples, some examples of external motivation might be exams, money, praise, grades, your career advancement. So thinking specifically about diabetes self-management, maybe you really want to see a great A1C reading. Or maybe you want your healthcare provider to see that you're taking your health very seriously and you want to get that validation from her or him. Another external motivator that people with diabetes sometimes cope with is fear. It might be that fear of diabetes-related complications. That could be an external motivator as well. In terms of internal motivation, these are things like curiosity, pride, interest, a sense of achievement, a sense of enjoyment, or maybe your own self-worth or feeling good about yourself. So those are examples that may come into play as you think about your own wellness goal and why it is that you want to achieve it. So if you haven't already, as I've been speaking here, just quickly jot down your own external and internal motivators on your action plan sheet. And if you don't have your sheet in front of you, you can always jot them down on a piece of paper or just kind of take note of them mentally as we go along here. So I'll give you a second to do that if you are following along on the action plan before I move on to the next slide. Okay, so now I want you to turn to thinking about your wellness skills. So these are the skills that are going to help you reach your wellness goals. So the first thing you might want to consider are your past wellness goals. So goals that you've set for your health or wellness in the past. What can you learn from them? So as you think about wellness skills, in other words, I want you to think about what you're good at. So for instance, these could be skills that you already possess. So for instance, if your wellness goal had to do with healthy eating, a skill you already possess might be cooking skills. So maybe you'll think to yourself, well, I'm already a good cook, so I can use these skills to help me eat breakfast in the morning. Maybe I can make a healthy breakfast omelet or a smoothie since I'm already interested in cooking. I also want you to think about skills that you want to build on. So maybe, for instance, you're already quite established in a regime of walking. So you might want to build on that and slowly start to run. So that might be something that you want to build upon. I also want you to consider skills that you're interested in pursuing, but you haven't yet pursued. So maybe you have an interest in meditation and mindfulness, which are great for your mental fitness, but you haven't had a chance to really pursue those interests yet, even though they're something that they are something you're interested in. So as you'll see on your worksheet, at the bottom of page 1, the question is, what skills and interests can help you towards your wellness goal? And then that question is broken down into 3 subcategories. What do I like doing? What am I good at doing? And what do I want to learn to do better? So thinking about your wellness goal, if you haven't been already, please do jot down some answers to those questions of skills and interests that you already possess or that you're interested in or that you want to build on that can be mobilized to help you achieve whatever wellness goal that you've identified at the very beginning. And I'll give you a second to jot those down, so I'll just pause for a moment while you do that. Okay, so before we turn to the specifics of exactly what you're going to do to achieve your wellness goal, we want to make sure that you're confident in what you're doing. So this is the knowledge component that I spoke about at the very beginning. So you want to know, first of all, that your goal is safe. So for instance, if you're looking to make some big changes to your eating habits, you should probably check with your healthcare provider or a registered dietitian, particularly if you are living with diabetes. It's always good to talk to an expert in the field. You want to also know that where you're getting your information is credible. And I think as we all know, there's so much conflicting information out there, it can be kind of hard to navigate and to know what to believe sometimes. So it's important to go back to the tried and true, credible, evidence-based resources like those provided by the Canadian Diabetes Association, Canada's Food Guide, etc. So you want to be cautious about popular media and the advice that you hear there. And I'm not sure how well you can read the cartoon that's pictured on the slide, but there's a patient and a physician, and the patient is asking the physician, which celebrity should I follow to get the best health advice? And like most humor, it's intended to make you laugh, but there's also an element of truth there that sometimes it's easy maybe to get information not from the most credible resources. So it's important to go back to those good, credible ones. And it's also important for you to know where you can find support while you're making these health and wellness changes. And we're going to go into some detail about social support in a couple of slides. But just as a couple of examples, maybe you'll find support from certified diabetes educators, maybe from family, friends, coworkers, registered dietitians, community organizations, a health coach from the Canadian Diabetes Association, for instance. So it's important to know where you can turn to get support as you're working on your health and wellness goals. So given what you've just considered regarding your motivation, your skills, and your knowledge, I now want to talk about how you can put it all into action. So why do we focus on goals so much? So if you have any familiarity with health coaching, you'll know that we're very keen on goals. We love goals, but we love goals for a reason. So goals help you in a number of ways. First of all, they help focus your attention on the task that you're working on. So in other words, they help you prioritize a little bit, and that's one thing that we do as health coaches quite a bit, is just basically help you make your health and wellness a priority because, of course, we all lead busy lives, and it's easy for these concerns to get kind of lost in the shuffle or get bumped to the list of responsibilities that most of us deal with on a daily basis. So setting a goal around your health and wellness helps focus your attention on it, makes it a bit of a priority. It encourages you to take action, and how you set your goal is very, very important, and we're going to be talking about that in a bit more detail so that you have a clear roadmap of the action that you're going to take. Goals help increase your determination. So again, making it a priority and something that you want to work on right now. And goals can help you create new strategies. So come up with some contingency plans and some plan Bs for when things don't necessarily go as smoothly as we would all hope that they would. So we create an action plan as a way to give you a solid roadmap to pursue your wellness goal. And any good action plan should have these components built in. So what you're going to do, how much, when, how many. So all of those components should be there in a good action plan. So now I want you to think about creating your own action plan. So if you go back to your worksheet, you'll see that on the second page, there are some boxes that are going to help you create your own action plan around your personal wellness goal. So a good action plan is specific, it has measurable components, and it leaves no room for ambiguity, which is really, really important because it's very easy to have a goal that's something like this: I will start walking, but that's the kind of goal that can easily get kind of lost in the shuffle because there's no real specific parameters about how and when that's going to happen. So it's something that's very easy to put off. As you can see on the other side of the screen, a good action plan looks more like this. I will walk 3 times a week around my office for 10 minutes at lunch for 2 weeks. So no ambiguity there. Exactly what you're going to do, when, and for how long is covered. So as I mentioned, a good action plan should cover those components: the what, the how much, the when, and the how many. So on your worksheet, I'd like you to come up with your own action plan based on the wellness goal that you identified at the very beginning of this webinar. So what are you going to do? How much are you going to do? When? And how many? So example would be 3 times a week. So if you haven't already, please jot down that action plan before I move on to the next slide. Okay, so the next step is figuring out who your social support is going to be as you work towards your wellness goal. In other words, who can you count on to motivate and support you in both the good times and the not so good times? So if you turn to page 3 of your handout, you'll see that there are spaces for you to map out your own social support system that you can draw upon as you work toward your goal. So some examples that you can see on the screen there might be specific friends, co-workers, your community, your neighbors, your family, different organizations or groups. But what I'd like you to keep in mind here is that quality is more important than quantity. So it's much more effective to have a smaller number of really great support people rather than trying to fill in all 4 of those boxes on your worksheet just with people you think might be supportive. So think about your best social supports rather than just trying to fill in a name into every box. So I'll just give you an example here. Last spring, I ran for Team Diabetes for the first time, and I had lots of really great support people in my life, so I probably could have filled out those boxes with a number of people. I mean, my spouse, my parents, all kinds, friends, family members, all kinds of great people. But in that specific context, my best social support person was a coworker who runs marathons and has been running for Team Diabetes for years. So I was able to ask her a bajillion questions about running and marathons and races and the logistics of what to wear and how do you do this, how do you do that. So she was my ideal social support in that specific situation. Would I probably choose her as a social support person if I were setting a different goal? Probably not, but in that context, she was really my go-to person. So thinking about your specific wellness goal here, it's really the most effective if you can think about the people who are going to help with that specific goal in this specific context. So if you haven't already, you can just jot down some social supports that may come in handy as you work on your goal. So next, I want you to think about how your environment can support you in your wellness goal. So if you look at the environment section of your handout, you can start to map out some potential sources of support in your environment. And what I mean by your environment is your home, your work or your school, and your community. So if you think about the ways that your home can support your goal, maybe you're focusing on eating healthy, and your roadblock might be that every time you decide to work on healthy eating, your spouse comes home with your favorite flavor of potato chips and sits down on the couch beside you and opens them up. So talking to your spouse about your goal is probably a good idea. So maybe not having them buy your favorite flavor of chips is going to be a way that home can support your wellness goal. If you think about the ways your work environment or your school environment can help to support your wellness goal, it might entail finding others who have the same interests or goals as you. So maybe that's starting a walking club at lunchtime. Or maybe at school it means not eating lunch in the cafeteria because that's a place where maybe you don't make the best food choices. So thinking about your work and your school environment and how it can support you is really, really important. And lastly, think about the ways that your community can support your wellness goals. So one of my roles as a health coach is navigational, so helping people find resources in their communities that are going to help align with their own health and wellness goals. So this is the kind of thing that I'm thinking of here, such as finding indoor walking tracks in your community that you can utilize during the cold winter months when you don't want to go outside because it's cold and wintry and slippery and dark and all those nasty things. So knowing about an indoor walking track can be a huge savior during the winter months. Or maybe your community has nutrition classes that are taught by dietitians. Or maybe there are mindfulness classes that you can take to help you learn more about meditation and make it a part of your mental fitness routine. Or maybe there's a great smoking cessation program in your community. So all of these resources may be useful when it comes to your own health and wellness goals. So start thinking about what's accessible to you in your community and how you can make use of them. And if you haven't already, there is a place on your worksheet for you to write this down. So how can your environment support your wellness goal? It says on page 2 of your sheet, at home, at work and school, and your community. So if you haven't already, just jot those down quickly. Okay, so by now you've thought about your motivation for making healthy lifestyle changes, and you've come up with a solid action plan. But now it's time for a word of caution. So successful behavior change is not a smooth process, even though most of us would like it to be that way. It takes time and effort, and it doesn't usually look like the diagram on the left with the smooth linear line between the old behavior, oh, I used to do this, to the new behavior as time goes on. Now I do this. Yeah, this was before, this is now, end of story. Pretty unlikely. More likely, it's going to look like the diagram on the right. So as you can see, there's still progression from the old behavior up to the new behavior, but the line is a little bit more wiggly, we'll say. So there are obviously some ups and downs, some peaks and valleys along the way, and that's inevitable. Behavior change takes time. It's a long process. There are ups and downs, and you need to be able to build on each small success and learn from any setbacks, because inevitably there are going to be setbacks. And we're not always going to feel motivated, since these downs can be quite not so good for our motivation. So knowing how to spark our own motivation is a really important skill to keep us moving forward. And we spark our motivation by thinking about the multiple reasons that we all have for changing our behavior, both internal and external. So often it is useful to do the inventory like we did at the very beginning. So what are my reasons for making behavior change? And it takes a little bit of self-reflection, thinking about why you really want to do something. And sometimes, those really kind of deep personal reasons, that internal motivation is going to be what sustains us. So our sense of pride, the fulfillment we get from achieving a goal, from building better relationships. But other times, we're going to need those external pushes to really jumpstart things. So for instance, maybe you're starting to make walking a regular routine, but you find yourself slipping a little bit. Well, maybe registering for a 5-kilometer race is a way that's going to make you commit a little bit more to doing it. So having that kind of external reason to go. Or hooking up with a buddy so that you have somebody to help keep you accountable as you move forward is really helpful. So someone who's going to make you go even when you're not totally sure you want to go. Or putting in an alarm in your calendar to remind you that you've got your yoga class Tuesday at 11 a.m. So it's a way to kind of set an external little reminder, a way to kind of make your health and wellness a priority, even though it's important to you internally and you're motivated because you want to feel good physically and mentally. Sometimes just making it more of an appointment, so using that kind of external motivation, is just something that gives you that little extra push to get you out the door. So the important thing is to figure out what is going to work for you. What mix of internal and external motivation do you need to keep yourself motivated? And when are you going to rely on your internal motivation? And when do you need those little external pushes just to sort of jumpstart things when your motivation might be waning a little bit? So as you figure out what does work for you and what doesn't, I want you to consider this quotation from Thomas Edison. I haven't failed, I've just found 10,000 ways that won't work. So it really is about changing your perspective and allowing yourself the flexibility and the forgiveness to kind of try different things and know that not everything is going to work well for you, but realizing that, your health and wellness is a lifelong process that you'll continually be working on, and figuring out what works for you isn't going to always be straightforward. So you have to kind of give yourself a chance to try different things and keep a positive attitude as much as possible. So here's a quick review of everything that we've touched on today. How your motivation, your skills, and your knowledge in the context of your social support networks and your environment all come together to determine how and when you will achieve a goal. So that's the I act. So how and when you're going to achieve the wellness goal that you've set for yourself. So your motivation is the I want. Your skills are the I can, so things you know how to do, that the skills you already possess. The knowledge is I know. So all of that in the context of the people that you surround yourself with and rely on come together to determine how and when you're going to achieve your wellness goal. And in the process of doing this, you've come up with a very personalized and solid plan about how you're going to make your wellness goal a reality. So I hope that will be useful to you all moving forward. So I want to thank everybody for participating in this webinar. And I'm going to turn things now over to Farah so that we can take some questions.
Great. Thank you so much, Alison. You've really delivered a really great webinar today, and you've shared with us some really useful tips and resources on how to stay motivated when we're trying to manage our diabetes. So with that in mind, we'll start with our first question from one of our participants. So I know you're a health coach with us here at CDA, but you're out located in New Brunswick. So one of the common questions our participants are asking are there any health coaches available, such as yourself, in different provinces?
Unfortunately, we're the only province so far that has the Live Well Bien Vive program specifically. I know there are health coaches all over the country. I can't really speak to exactly who they are and what they do. We're very fortunate in New Brunswick to have this program, and it is free to any of the participants who are listening who are from New Brunswick, who live in New Brunswick. And we target 6 areas of the province, so there are actually 6 of us all around. So if somebody is in New Brunswick and looking for more information about how they can get in touch with a health coach in their area, they can go to livewellbienvive.com and contact one of us to talk about health coaching in New Brunswick.
Great. Thanks so much for that clarification, Alison. One of our next participants have asked, sorry, I'm just losing track here because there's so many questions that are coming in. I do hope that we get to them all, folks. So we'll try our best to get them answered before the end of the hour. One of our quiet participants has asked, what is your opinion on using motivational interviewing with your patients?
Yeah, no, absolutely. Motivational interviewing is something that we're all trained in as health coaches and that we use quite a bit. So really, in terms of motivational interviewing, our goal as health coaches is always to get the client to recognize his or her own motivation for doing things. So we ask a lot of open-ended questions and really urge people to reflect on why it is that they want to make changes for their health and wellness, particularly going beyond, the external reasons that I've touched on a little bit today. So, my doctor wants to see better blood sugar readings, or I talked to a dietitian and I guess I really need to change my diet. So, all of that is important, but as I've been trying to emphasize today, we really try to ask questions that are going to help clients recognize that they have their own motivation for making changes, and that really more personalized kind of motivation is what they need to consider and reflect upon if they really want to make changes for their health and wellness.
Great, thanks for that explanation. A next question here, I'm not too sure if it's something that you can answer, Alison, but I thought I'll ask it anyway. What is the best guide to use to help with meal plans?
Yeah, meal planning is definitely something that is most useful to talk to a dietitian about, a registered dietitian. So as health coaches, we do use some basic credible resources with people like the Canada Food Guide or CDA's Just the Basics Guide. But if people have much more detailed questions in terms of food and diet and really what they should be eating, I always refer them on to a dietitian. So if you're living with diabetes, usually I recommend a dietitian who's also a diabetes educator. But if you're not living with diabetes, then any registered dietitian in your community can be a really great resource to help you think about meal planning and learn some of those skills. And March is Nutrition Month, so I'm sure a registered dietitian would be extra happy to hear from you in March.
Great, thanks for that, Alison. Our next question here is coming from a parent. My daughter has type 1 diabetes and I find it hard to motivate her. How do we keep our youth motivated, and do we approach this group differently?
I think that's a really good question. And the tricky thing about motivation is that true motivation really has to come from within. So, as parents, we can certainly help motivate our children through sharing with them really the realities of type 1 diabetes, particularly in terms of, good self-management and what can go wrong if self-management is not really kept in check. So that can certainly be a motivator. But I think it's really important for parents to kind of open up space to have a dialogue with their kids about, why it's important to them to really manage their diabetes, because, they're the ones who are going to have to manage the conditions for their entire lives. So, I think talking to the daughter about why it's important to her and and finding ways for her to kind of take on a bit of that ownership is going to be the best way to encourage her to be motivated for good self-management in the long run.
Great. Thank you so much for that response, Alison. Our next participant has asked, how do we help our patients that have set goals but have lost motivation along the way?
Yeah, that's a really great question. And I mean, as I've indicated here, motivation is not kind of a smooth linear thing that we have, and then once we have it, we always have it. It does tend to wax and wane. So if you have a patient who is lacking in motivation, I think talking about his or her reasons for making changes, returning to those is really important. So, as a healthcare provider, you're often a good source of external motivation, so talking to them about why it's important to follow these behaviors, but also opening up the space to talk about, why it's important to the patient. And I would also urge, starting small. Sometimes, we get overwhelmed with all the things that we want to do for our health and wellness, or that we feel like we need to change in order to be healthy. So really urging your patient not to do everything all at once, but instead picking a very small place to start, setting a really small goal, even with kind of the parameters of the action plan that I've included here, is often a good way to help build their confidence. And once they start achieving goals and feeling more confident, then it's a lot easier to move forward and, continue to set more goals for themselves.
Great. Thank you so much for that response, Alison. This next question kind of piggybacks on that, and it's also from a healthcare professional asking, is it okay if I set more than one goal with my patients, and how many is okay?
Yeah, that's a great question, and that's something that we discuss as health coaches quite a bit. Kind of our rule of thumb is sort of to work on one thing at a time. So we really want to make sure that our clients have established habits before we start moving on to something else. So for instance, if they're working on something in the area of physical activity, we want to make sure that they're consistently achieving their goals in that area before we switch to, say, healthy eating. That being said, if you have a really highly motivated patient, I think some of them can definitely withstand working on more than one thing at once. But the trick is just making sure that no one is getting overwhelmed and that they're not feeling like they're trying to change everything all at once. Our kind of tagline as health coaches is small steps equal big results. So the idea that we take small incremental steps towards changing habits instead of trying to do, everything all at the same time is really kind of the bedrock of what we do. So you just want to make sure that instead of trying to do everything at the same time, that they really are moving slowly and consistently and building habits before they start working on different goals.
Great. Thank you so much for that response. Some of our other participants have asked a similar question, and it's around actual health coaching training and where they could receive that, and if there are any recommended good educational resources for developing their health coaching skills.
Oh, that's really interesting. At this point, it's almost a gray area in that anybody can really call themselves a health coach, and there are different training programs that are out there. I don't really have any one that I would kind of recommend or get behind or say is kind of the best way to do it, but I would say probably the best route for that would be to kind of get in touch with me after the webinar, and we can talk in a little bit more detail. But for instance, with our program, we do our training in-house, and we kind of have our own training program set up. But there are training programs all over the place, particularly in the States, and it's really becoming quite a burgeoning field. But there's no kind of real one-stop shop for becoming a health coach or for taking on training at this point. But I think in future years, because it is becoming such a popular area, that we're going to see a bit more in terms of certification and a little bit more official parameters around what it is to be a health coach.
Great. Thanks so much, Alison. We'll take our last question here. So our participant has asked, what would you suggest when clients stop coming to appointments even after a few attempts to contact them?
Yeah, this is tricky. And I think, anytime you're working with people in terms of health and wellness goals, I mean, there is going to be a certain degree of people, dropping out, kind of falling off the radar. So I think, the best that we can do as support people is just continue to be supportive, continue to reach out and let them know that you're there whenever they're ready to return, and to really take that kind of non-judgmental approach that, people will come back when they're ready and they'll make changes when they're ready, but, it may just not be the right time for them to be working on their behavior change, and it's a long and difficult process, and it is a process with ups and downs. So, I would say keep that connection and that dialogue open, but realize that it sometimes does take time for someone to be ready to want to make these changes.
Great. Thank you so much, Alison. That does conclude our webinar for today, folks. I'd sincerely like to thank Alison for speaking on behalf of us here at the Canadian Diabetes Association. It has been such a great learning experience. I just want to remind everyone that our webinars will be made available online, so that'll be on diabetes.ca/webinars in the next coming few weeks. We have a few more webinars coming up for this series. So we have one next week on pulses. The following week will be on foot problems, and we'll end off the series on March 23rd with sexual health. Alison was actually featured along with some of the other Live Well Health coaches in our autumn 2015 issue of Diabetes Dialogue. So for some information on that, please subscribe, and as well as to subscribe, please visit diabetes.ca/dialogue for your copy today. And for any other questions that you might have with relation to diabetes, please feel free to call us here at CDA anytime. We're available at 1-800-BANTING. So that's 1-800-226-8464. And again, for those of you, if we didn't get to your question today, or if you have any other questions related to our webinars, please feel free to email us at webinars@diabetes.ca. Thanks for joining us today, and we hope you tune in next week. Have a great night. Thank you.